So can you see the slides? Yes. Vida, you can see the slides, Vida?
Yeah.
Okay. So my name is Shazia Khan, and the unit we're going to do today is effective communication in health and social care. So we're going to be looking at that unit, and we're going to be looking at the assignment discussion today. Before I go through the assignment discussion, I'm going to go through the learning outcomes with you. Is everyone okay with that? So I'll briefly go through the learning outcomes with you to identify what we did in each learning outcome. So you've got a better idea of when we're doing the assignment discussion, you've got a little bit of an idea of what we've been through. So the learning outcome 1 that we went through was to understand the communication approaches used in health and social care. Okay, so we looked at the element of what are the reasons for communication, why people need to communicate within health and social care roles, and why it's so important to communicate with other individuals, families, maybe patients, carers, and maybe other professionals as well. And the main reasons why people communicate, so to give information, to interact, to obtain something from someone as well. So it might be something about the patient. We went on to look at communication in the sense of verbal communication, which is active listening, open questions, things like paraphrasing. We then went on to look at non-verbal communication. What is non-verbal communication, Vida? What can be non-verbal communication? Could that be your body language? So it could be your body language, your touch, your eye contact. So we looked at that. Written communication, we looked at care plans, medical records. We also looked at the person-centered communication and learning outcome 1. We looked at the communication passports, and we looked at elements of the group communication, so therapy groups, team meetings. We also looked at cultural sensitivity and awareness, confidentiality, and we looked at explaining the importance of effective communication in health and social care. So why it's so important within health and social care, things like ensuring any sort of safety, builds that element of trust, enhances team collaboration, supports emotional and psychological well-being, promotes health literacy and respects cultures, reduces any sort of conflicts, and enhances any sort of care as well for the individual. So that was learning outcome 1 quickly. Now, these are individually done in sessions, so you could listen to them. They're on Moodle and they've been recorded. Learning outcome 2 is to understand the communication needs and preferences of individuals. In learning outcome 2, we looked at how to determine an individual's needs. So what are their needs and preferences of individuals? So they've got different needs. And we had to look at whether they are ill or whether they have a disability or any other ability that they can't communicate the way they can communicate, okay? We also looked at the person-centered approach, and also standard 6 guidelines and the person-centered care that was given. We then went on to look at effective communication in learning outcome 2 and informed decisions in learning outcome 2. We also looked at theories of effective communication in learning outcome 2, which we looked at the linear model, the interactive models, and the transactional models. We went on to look at exploring different models, such as the communication model. We looked at different ways you can assess or review individuals' needs and preferences for communication. Ask the individual. It's really important to talk to the individual. Make sure you identify their communication needs. Observe the individual. So, determine what their needs are. You can observe their body language. You can observe how comfortable they are with people sitting around and how they like to be communicated to. Ask other people, so people you work with, maybe family, maybe care professionals, friends, how this person likes to communicate. Read the individual's care plan or file to identify certain things. Also in learning outcome 2, we looked at the approaches used when promoting effective communication, so verbal, written, non-verbal, use of interpreters, communication, tone of their language, the listening. We looked at active listening, and we used the model, which was called SOLAR, which is sit squarely, open posture, the L for lean towards the other person, the E for eye contact, and the R for relaxing. We looked at written communication, non-verbal communication. We looked at the element of, in learning outcome 2, the element of the use of interpreters and advocates. We looked at communication aids, such as charts and books, picture exchange communication, which is called PECS, Braille, symbols, speaking aids, and also sign language, British Sign Language, BSL, or Makaton. We also looked at the services and resources to promote effective communication, things like interpreters and advocates. We also went on to looked at the England.NHS UK, communication and boards, and autism.org.uk. So there's websites that you can use to help support you as well. And we looked at support groups and networks as well, how they are helpful in regards to it. So then we went on to learning outcome 3, which is to understand barriers to communication. So here we looked at barriers in communication, what kind of barriers are in communication. So things like noisy environment. If there's a noisy environment, people can't listen, they can't, if something's so loud and they've got hearing aids in, it will make it difficult for them to communicate. Uncomfortable environments and things like poor lighting or heating, lack of privacy within an environment, and lack of awareness of the individual's needs, their beliefs and their wishes. So, you need to take them into account. Another one we discussed in a lot of detail was cultural differences. People may not be able to understand you. They may feel like they're being ignored because of cultural differences. Language barriers is another element that's quite a strong barrier, which is, that speakers not being able to speak or understand the other's language, and this affects communication. Poor use of unavailability of communication aids, and the use of medical slang or jargon, the language of what you're using when you're talking to the individual. The individual's condition may present a barrier to communication, like, for example, if the person has dementia or is autistic, an individual's attitude and their feelings and their values and their beliefs as well. We also looked in learning outcome 3 at the barriers to communication, but looked at physical barriers, such as noise, distance, maybe poor lighting, environmental distractions. We looked at physiological barriers, such as maybe difficulty hearing. It could be conditions like stuttering, maybe someone's, speech difficulties, visual impairments, it can affect their ability to read, communication, or, cognitive impairments, like people with dementia or learning difficulties might affect or be, affected or maybe not able to understand things. We also looked at psychological barriers, whether there's high levels of stress or anxiety and low self-esteem. We looked at prejudice, how they would pursue something, and language barriers, like we said, they may be different native languages. They may not understand each other. So there may be different languages, they may not understand each other. And then again, the use of jargon, medical jargon, try to stick to, avoid using medical jargon in communication, because that can impact on it a lot. We looked at cultural barriers, and we looked a little bit at that earlier as well. How different cultures will have a different way of expressing themselves. Systematic barriers. So in some setting, there's a strict hierarchy, which might prevent open communication between different levels of staff. Lack of training and inadequate resources. So there may not be hearing aids or communication boards. And then attitudinal barriers. If a person feels that communication isn't relevant to them, they may not pay attention. And sometimes information overload is a big thing as well, giving them too much information for them to retain that information, and poor listening skills as well. If you're not listening and you're not able to understand, then that individual's not going to be able to pay attention. We also looked at learning outcome 3, identifying how to overcome these barriers. So things like avoid using the jargon, not speaking too quickly, ensuring communication aids work properly, making sure that the environment is comfortable for the individual, taking time to listen to that individual, and also providing clear explanations to the individual. External barriers, physically able to meet the communications needs, dealing with difficult people, conflict and aggression, and we went through elements of that, being aware of identifying emotional triggers, and we looked at the transactional analysis as well. So we looked at the parent ego, the adult ego, and the child ego. We then went on to look at de-escalation techniques, so verbal techniques and non-verbal techniques, and how to check understanding when communicating. So we looked at elements of trying to overcome barriers and checking how they affect communication. So that was learning outcome 3. Are you both okay with that? So I've quickly gone through that. That is all available on Moodle for you, and they're all recorded sessions individually, okay?
Okay.
This session now we're starting is the assignment discussion session. So we're looking at the assignment today. So firstly, the 3 learning outcomes to understand the communication approaches used in health and social care, which I've just gone through each one briefly, understand the communication needs and preferences of individuals, and learning outcome 3 to understand barriers to communication. So if you can see this, I'll increase the size for you. This is an assignment declaration. Why do you think it's so important to put an assignment declaration when you are putting in your piece of work? Why do you think it's important that you sign this, Vida? Esperance, Vida? What is it? What is it to make sure? Can you see this?
Yeah.
What is it to make sure? Why do you think it's important that you read this carefully and sign it? So I'll go through it with you. So this is a form that needs to be completed by you, okay? And this form identifies, you have your name, your student name, and your course on it, and the assignment name on it, okay? And here you are saying that I confirm that the assignment that I'm submitting is my own work, and that I have read and understood the college's guidance on plagiarism. What's plagiarism? Anyone? When you plagiarize something, what do you do? Vida? So plagiarize in someone's work is copying, okay? So you would say that I clearly referenced your work, so you have made sure that you have clearly referenced your work in both the text and bibliography or references and sources used in the work. So you cannot cut and paste things from anywhere. You need to make sure you are referencing things and paraphrasing things. You are fully referenced, including page numbers, and used inverted commas for text from books, journals, or webs. You've provided sources for all tables, figures, data that are not your own work, and you have not made use of a work of other students, past or present, without acknowledgement. This is your own. This includes any of your own work that has been previously or concurrently submitted for assessment either at this or any other educational institution. So here you're saying you're ticking that to say, have you not copied anyone else's work? You've not submitted an old assignment that was submitted to a different university, or you've not copied anyone from any other, you've not colluded with anyone. You've not sought or used any sort of services, essay bank or anything. In addition, you understand that this is a false claim in respect of the work and result disciplinary action in accordance with the college's regulation. And you are signing that declaration. That has to be done at the start of the assignment. The reason this has to be done is because some people submit assignments from AI. Okay, and you cannot use AI to complete any assignments. To get the declaration, there's a link there that you could get the declaration, and you need to sign this beforehand. and submit your assignment with this to make sure that the work you are submitting is your own work. It's not anyone else's work. You've not done any collusion. You've read the Centre's UK Varsity statement on plagiarism, and you've signed that as well, and you've declared that the work you've submitted is your own work. It is really, really important. And when I go through the assignment, I will keep coming back to plagiarism. It's so important that you don't plagiarize your work, okay? Is that okay, Vida and Esperance? Any questions on that? Okay.
Okay.
So, okay, thank you. What information needs to go on the assignment at the start? So you need to have your name on it. It's really important you've got your name on, as the assessor who's marking it will know whose work it is. It needs your registration number on it. It needs your tutor's name on it. And the word count for this assignment is 2,000 words. Okay. And it should have the date of submission on it. And the unit level, which in this case is level 3, effective communication skills. Okay, so this needs to go on the start of the assignment. Plagiarism and collusion, and I'm going back to this again and the importance of this. Students must submit and complete work that is their own work, nobody else's work, no copying, nothing. Plagiarism is presenting the thoughts, ideas, and words of another person as if they were your own. And collusion may occur when students' assignments are very similar. And in some cases, the assignments are not just similar, maybe identical of another fellow student. This is also amounts to plagiarism. Plagiarism is taken very seriously, and the students are strongly recommended to refer to the academic misconduct policy, which again is available on Moodle for you, which is the virtual learning environment. Start of the assignment, again, table of contents. The font size needs to be 12. There needs to be 1.5 line spacing, and page numbers need to be inserted. It needs to be Microsoft Word format, not Google. And if you do not have that, there's a link there for Word, okay, that you could go on to and use this for free. So if you download it and use this free, do not do your work on Google. It will not get marked if it's on Google. So it needs to be on Word. Okay, do you understand that, everyone? Yes? Esperance, Verda, do you understand it needs to be on Word and not on Google?
Yeah.
Yeah. You need to do an introduction. You need to word count needs to be 2,000 words, and make sure you are putting all the assessment criteria, AC and headings, and not changing the wording of the task. General information, this is just telling you that the unit is taught via Moodle on the VLE, and all the information, any sort of additional reading, handouts, the assignment brief, which I'll show you towards the end. And also I've got 2 articles to show you towards the end as well. This is all on the virtual learning environment, where you can see all the course material and everything that's available for you for this unit. Okay, so anything, also the 3 learning outcomes that we've done and today's session will be all recorded and will be all on Moodle. So the learning outcomes will be on Moodle, and the recorded sessions as well are all available on Moodle. Moodle is the main virtual learning environment that you need to be using for any sort of course materials, additional reading. Okay, so let's go into the task. The first task, there's one task only for this, okay? So the assignment task is here. Adrian Jones so it's a case study. Adrian Jones is a 47-year-old man who has chronic breathing problems and uses oxygen most of the time. He lives at home with his wife and 2 teenage children. He has had numerous admissions to hospital when his condition worsens, and needs the support of care workers when he's at home. Communicating with Mr. Jones and his wife is obviously really important. However, he can't talk for long periods and is quite often so tired and falls asleep. Okay, so this is the scenario that we need to look at in this. Okay, with this scenario, you've got the assignment guidelines here, you've got the task. So you've got the task to write a case study report for healthcare workers on the importance of communication with Mr. Jones and his family. The case report should include, so there's 4 parts to it there, okay? So the first part is you would put that, do not change the headings or anything. Put that as a heading. Don't change the wording, and then write under that, write the answer. The reasons and importance of effective communication in health and social care. That's the first part. So when you're looking at this, it tells you to look in learning outcome 1. So the reason and importance for communicating, effective communication in health and social care will be on page 4 in learning outcome 1, and it carries on from page 4. Okay? Is that okay with everyone? Esperance Vida? So here you look at reasons why people communicate. So because it's 2,000 words, you've got 4 parts to this task. How much words would you do in each part then? Vida, how much would you do? So if it's 2,000 words, your assignment, okay? How many words would you do if you've got 4 parts? To answer 500, excellent. 500, yeah. So you do 500 on this one, 500 on that one, 500 on that one, and 500 on that one. And I'm going to go through it each with you so you've got a little bit of an idea, okay? So the first one, reasons and importance of effective communication, health and social care. That's learning outcome 1 from page 4 onwards. So that looks like things like, it could be things like that they need to express their needs, they need to have their preferences, their feelings, maybe to obtain information, why people communicate, to give information, to interact socially, so you need to be looking at elements of that, effective communication. So you need to look at elements of that in learning outcome 1. Are you okay with that? Yeah? So that's learning outcome 1. Put that as a heading, write 500 words underneath there. Okay? The next one is the importance of determining Mr. Jones' communication needs and preferences. And that's looking at learning outcome 2. Why it's important to identify that. And you would look at elements of, the 2.1 here and page 13 onwards. So, the importance of determining someone's need. For example, if someone has dementia, in this instance, Mr. Jones has health problems as well, and how you would establish their needs and what you would look at in making adjustments to the communication. So the different ways to assess people's needs, maybe ask the individual, observe the individual, also ask other key people, his wife maybe, because she's around, his children maybe, Mr. Jones' children. Read the individual's file or care plan. Make sure you're looking at that in detail. So that would be an element of using that to find out how how that person communicates and what their communication needs and preferences are. So you would need to talk to any sort of care professionals, any care workers. He has a care worker coming, his family as well, and talk about that. So that would be one heading, and you would write under that. The third one is compare and contrast the approaches when promoting effective communication. So compare and contrast the approaches, and that's things like, learning outcome 2, page 16 onwards. So that would be looking at verbal communication, written communication, and it would be looking at verbal in the form of speaking words and making noises, maybe written communication, letters, emails, etc. Non-verbal communication, body language, the use of interpreters and advocates, communication aids, sign language or Makaton. These are comparing and contrasting the approaches used when promoting effective communication. So you would look at that, you would put that as a heading, and you'd write 500 words under that. And it could be things like, in verbal communication, you look at the vocabulary, the tone of the voice, it may be the pitch of the voice, the volume, making sure that you're listening as well. And obviously, active listening, written communication, taking advantage, if they don't understand anything, drawings or writing or diagrams, Non-verbal communication, as we talked about earlier as well, body language. So making sure that the posture and are relaxed facing the person. Touch, it could be gestures, it could be the behavior, and the use of interpreters or advocates, why they need to be the use of them. Communication aids as well, communication charts and books, pictures, exchange communication systems, braille symbols or pictures or symbols, speaking aids. It could be looking at British Sign Language as well, and things like Makaton as well, and trying to look at the different approaches that are used for different people. If they maybe, need have issues with hearing, what you would use, and if they are, anyone that, has issues speaking, what you would use for them. So, that is the third one to compare with that. The final one and the fourth one is another 500 word on barriers to effective communication and how these can be overcome. And that's looking at element of learning outcome 3, where you would look at the barriers to communication, which are things like noisy environment. It could be uncomfortable environments, such as, so that would carry on from page 5 onwards on learning outcome 3. Lack of privacy with an environment, also cultural differences, language barriers, poor use of communication aids such as hearing aids, the use of slang or terminology which is not understood, so the jargon that is used, the medical terms that are used, individual condition at the time you are communicating with them, which has a big impact on it, and the individual's attitude as well. You can look at physical barriers, physiological barriers, psychological barriers, language barriers, and how to overcome these barriers as well. That would be page 13 on learning outcome 3, which you would use things like use simple language, straightforward language, not talking too quickly and speaking clearly so that the individual is able to understand. Also identify that you're listening to them. You need to be showing that you are actively listening to that individual, ensuring any sort of communication aids are working correctly. For example, having work batteries are, available, communicating with the individual in private and quiet spaces, making sure that there's no elements of breach of confidentiality or anything, ensuring that the environment is comfortable and quiet for that individual, because some people may not like to have environments that are loud, that impacts on communication. Ensuring that interpreters and advocates are available when required, and taking time to learn about the person's communication needs and preferences. And making sure that you are talking to someone without using any sort of medical jargon, because it's really important that they're able to understand everything. So these are the 4 parts of it, okay? Do you both understand that? So use that as a heading, write the answer under it. Use that as a heading, write the answer under it, and refer to the case study about Mr. Jones as well, and compare and contrast the approaches, and then barriers to effective communication. So there's 4 parts to this task, okay? Each task is 500 words. You do have 10% leeway, so if you go a little bit over, you've got the 10% leeway. So the case study should be 2,000 words. Your work should be informed by a wide range of research and demonstrate correct citation and referencing techniques. So the referencing you are using, which we'll go through, is Harvard System for Referencing. Again, Harvard System for Referencing and a range of academic reliable sources. Make sure at the end of the assignment, make sure you do a conclusion, and a reference list or bibliography needs to go at the end, and it needs to be in alphabetical order. And I'll reiterate this throughout when we look at support and guidance to help you, okay? You need to make sure, is everyone okay with the tasks? So you've got these 4 tasks to do. Do not change the wording, okay? Students have, and I keep saying that some students change the wording. Don't change the wording. Put it as it is as a heading, okay? So this will be your first heading. You will write 500 words under that. This will be your second heading. You will have 500 words on that. This will be your third heading, and you will have 500 words on that. And barriers to communication will be your fourth heading with 500 words. Is that okay for you, Esperance and Vida?
Yeah.
Any questions on that tasks? Esperance, are you okay?
Yeah, sorry, I'm just a bit busy, but I'm fine.
Oh, no, it's okay. Sorry. Are you okay with that? Are you able to, do you understand the tasks and what is expected of you?
Yeah.
And Vida, are you okay with that? I think Vida's put something. Yes, okay.
Yes.
So each one is 500 words, okay? Make sure you stick to that. You do have 10% leeway, but make sure you stick to that, okay? Assignment guidance and support. So this is some guidance and support for you to take on board when doing the assignment, okay? So make sure you start with an introduction and end with the conclusion. Now, the introduction and the conclusion doesn't have to be long. It can be 3 or 4 lines just to tell me what you're doing. That's it. Make sure you are using Harvard system for referencing, and you can refer to online sites that will help you. And this is the link there, which I can go back and I can show you again towards the end. If you are using diagrams, please make sure you reference them accordingly. Make sure you have a bibliography, reference list, and it is in alphabetical order. Try to use more examples when explaining certain concepts, for example, when looking at theories. Make sure you are using the assessment criteria as a heading for each part of the task, as I explained, for example, task 1, and how it should use use each one as a heading and then write under it. You need to be referring to the indicative content and checking your word count all the time. Important points: give proper headings and subheadings. Make sure your document looks presentable and professional, and number your figures and diagrams. Follow the numbering on the assignment against any assignment brief. Ensure at least 12 to 15 references. Referencing should be Harvard system, and the UK Varsity uses the Harvard system of referencing. Keep a check on your word count, minus 20% tolerance limit. So if you're using anything online, it needs to be below 20%, especially AI as well. Remember, there's a grading pass or refer in this, and the word limit is 2,000 words. Do not use AI software to write the assignment. There is only 20% tolerance allowed, else it will be considered malpractice. So it needs to be below 20% if you use it, and it needs to be, if it's over, it will be considered as plagiarism and malpractice. Please mention the grade you want to achieve. It's graded. So in this case, you don't need to mention because it's a pass or a refer. Follow the numbering of the assignment presentation against the assignment brief. Some useful tips: read the tasks carefully. Read the 4 tasks. You have 1 task and it's got 4 parts to it. Read it carefully. In the brackets is where the answers are, where you can get information to do the assignment. Okay, so use them. Focus on the tasks and command verbs. Things like broadly on guidance, command verbs you can cover: explain, define, describe, 100 to 125 words, assess, examine, and clarify, 175 to 225, and compare, contrast, critically evaluate, 250 to 300 words. Harvard referencing needs to be Harvard system. So in the text, it needs to be author date. For example, Slack, Johnston, Brandon Jones, 2011 in the text. In the references towards the end, it should be shown as the full citation, with the publisher, with the edition. Okay, minimum of 6 references, books, journals, articles, websites should be included in your bibliography, and give proper headings and subheadings. Make sure your document looks presentable and professional. Avoid using bullet points. Don't bullet point things, okay? That's not a professional document. If you've got headings and subheadings, that doesn't mean you bullet point your work, okay? You need to make sure it flows and it looks presentable. Word limit 2,000 with 10% flexibility, and plagiarism and tolerance, you must be below 20%. You need to make sure you are not copying and pasting work, as it's plagiarism and would lead to academic misconduct. Make sure you reference all your work and all your sources that you are using. Make sure you check your grammar and spelling. Refer to ebooks and journals or Moodles for this unit. And make sure you are using UK conventions rather than using American style language. Also, make sure your bibliography is in alphabetical order. I've realized when I've been marking people's work that the actual bibliography is not in alphabetical order. Okay, so make sure you're using that. If you are using UK Varsity slides, then the reference would be as below. MDT 2022. In the bibliography, it'll say multidisciplinary teams, learning outcome 1, slide number 2 to 10, UK Varsity, published on 15th of January 2023. So that's how you would reference the slides if you are using them. If you have any queries or any questions to ask, email learnerwork@ukvarsity.co.uk, and submission of the assignment is to be done on learnerwork@ukvarsity.co.uk. And the assignment submission is 2 weeks after the completion of the unit and its delivery. Now that you've completed the unit and the assignment discussion, you have 2 weeks to submit the assignment. So before I go back into this, I just want to show you 2 articles that you can read as well around this in your own time, which will help you. So the first article is this one. The first one is called Health Communication in Primary Health Care, and it's a case study of ICT development for health promotion by Amina Jamil Mahmood. Have a read of that. That article's really good. It looks at the element of ICD within the primary care and how it's been singled out. This is available on Moodle for you to look at in your own time. And this is really important, looking at the methods used, the study group, the different summary of data description, sources, methods for data description. Have a read. Can you all see this article? Yeah?
Yeah.
Okay, and the next article that you can have a read of, which is another really interesting article on, just 1 minute. It's Black Lives Matter. It's another article that quite interesting on in regards to communication, and it's an article called Black Lives Matter, and yes, and it looks at the element of the how people experience events from childhood and things like that. So have a read of that as well. That's available all on Moodle for you. So you need to go onto Moodle to get any sort of additional reading around this. Okay. The one thing I did want to show you is the assignment, how it looks on Moodle, because if you go onto Moodle, I've taken everything off the assignment, so the assignment is available on Moodle for you. Okay, just doing health. No, this is not it. Just bear with me 1 minute, and I
Can
will.
I ask you for a favor, please, Doctor?
Yeah. Yes.
Myself, I still don't have access to assignment on Moodle. Please, if you can just share the assignment on group WhatsApp or on my...
Let me just see if I can do it. So this is the assignment. Can you see this now? Let me just have a look. Can you see this? This is the assignment. I've just taken everything off the assignment. Where is it? Sorry. Why is it not sharing? Let me just share it again. There. Can you see this here? This is the assignment. This is how it looks on Moodle. Okay, can you see it, Esperance and Vida?
Yeah. Yeah.
This is how it looks on Moodle. It tells you the date. So you submit this as a front cover, tells you the word count, you sign everything here, confirming the declaration, and the assignment is there. I've just copied and pasted all that. So this is asking you to read the scenario and then answer the 4 parts there, okay? And that is 2,000 words. So this is available on Moodle. It looks at the learning outcomes and it looks at just the tutor's comments and things there, okay? So this is available for you on Moodle. I'm going to see if I can...
I don't have that access on Moodle. That's why.
Why have you not contacted them to get access?
I did. Sorry, excuse me.
Yeah.
Last time they gave me the appointment to ring me and go through it on Zoom or WhatsApp video call, but
Yeah.
one code. So I'm still waiting. I'm still waiting for them.
Okay, let me just. I've put something, but it can't drop it in. It can't do it. It's saying, can you email me and I'll send you it via email?
Right, on Lana Work.
No, you email me on Shazia, SHAZIA at ukvarsity.co.uk, and I will send you the assignment then, okay? But
Oh.
you really need to get your Moodle sorted out, Esperance.
Yeah, I've
Yeah.
discussing them, but I don't know why.
Yeah. So just email me and then I will send you the assignment, okay?
Thank you.
Email me on shazia@ukvarsity.co.uk, okay?
Thank you.
So a lot of the read them case studies that I've given you, the articles, they're on there on Moodle that you can go on to any additional reading. The learning outcomes are all recorded for you now. So learning outcome 1, 2, 3. The session, today's session is also recorded. Everything for the assignment that I've taken off from here is on the assignment that you need to do. Make sure you are doing each one as a heading and then writing under them, okay? The answer. Make sure you're doing it clearly. Make sure if you have any questions that you are emailing learnerwork@ukvarsity.co.uk. And also, if you have any, you have 2 weeks now to submit the assignment because you've completed the unit and you've completed the delivery of the unit, okay? So have you got any questions, Esperance or Vida, around the assignment discussion?
No, thank you.
No? So just email me, Esperance, I'll send you that. And Vida, good luck, everyone. It was lovely teaching you. And good luck with getting on with the assignment. And if you have any questions, again, learnerwork@ukvarsity.co.uk. Let me see, I think Vida, no, you've got no question. Thank you, Vida. And thanks for attending the session.
Thank
And good luck with getting on with doing the assignment, okay?
you.
And make sure you stick into the guidance and the what's required of you, okay?
Thank you. Did you say your full name?
Shazia Khan.
Right. At UK Varsity.
No, it'll just say it's just Shazia at
Yeah.
ukvarsity.co.uk.
Okay.
SHAZIA@ukvarsity.co.uk.
Thank you.
Is that okay? Thank
Thank
you.
you.
Good luck with getting on with the assignment, both of you.
Thank you very much.
Thank you. Okay, bye.
Bye.